For those that don't know me, my name is Deb Cohen. I'm a Malakadi woman from the southeast of Lutruwita and the healthcare manager at CTAC. Let's together acknowledge that today we meet on the land of the Malakadi people of the Southeast Nation, the traditional custodians of this land. And I also acknowledge the continuing connection to our land, our sea, and our community. This is Aboriginal land, always was, and always will be. I pay respects to the 4 Southeast Nations of Lutruwita, the Moonin of Hobart, the Lakwani down Research Bay Way, Nononi of Bruny Island, and the Malakadi mob of the Yuin, and to all nations of Lutruwita and afar. I pay respect to elders that have passed before me, and those still present and influencing my life today, and to the young leaders of our future that will be carrying our values and vision our people have for the future of our country. Today we come together to celebrate the opening of the Cygnet family practice after our service. Lapuli no Reno Molana. Come, this is my hand. Feel earth on sole of foot. We run together, friend. Welcome to Malakadi country, and thank you.
To my family, my husband Stephen, my mum Marjorie, my sisters Leanne and Sharon, to the long waiting time to see a doctor and not being able to be seen on the day when you and your family are sick or injured. There doesn't need to be any more consultation and delay in action. We need to be bold and act now to embrace change. The definition of madness is to continue to do the same things and expect different results. I've worked in general practice for the last 18 years, first as a registered nurse and then later trained to be a nurse practitioner 12 years ago. For those of you who aren't sure what the difference between a registered nurse or practice nurse and a nurse practitioner is, because they sound very similar, a registered nurse can work in general practice, but a nurse practitioner is someone who has studied at master's level, they've completed a graduate certificate in their area of specialty, and they've worked many years in general practice, so they are the most qualified clinical nurse that we have in general practice. Nurse practitioners can work autonomously, they can prescribe medication, they can order blood tests and x-rays and ultrasounds. They can also refer directly to medical practitioners. They can diagnose and treat many conditions. I've co-owned Cygnet family practice for the last 9 years, and I understand the needs of a person seeking care today. As a general practice owner, I also understand about caring for our team. Asking our already fully booked doctors and registered nurses to see extra people every day is not sustainable. A general practice team should be able to have morning tea, a lunch break, and leave on time and spend time with their family. The GP of my childhood, who worked 16 hours a day and was on call 24/7, no longer exists, with good reason. In our neighbouring New Zealand, the UK, and also with nurse practitioner-led models in Canberra that have been going for 9 years, it's not rocket science, this model works. In UK, nurse practitioners and paramedics work side by side GPs and other allied health professional and general practices. In the UK, paramedics are authorised to prescribe by doing extra training. What a workforce shortage solution that could be here. So what we need to do is look at innovative models that work and of health professionals that can meet the needs of our population now, not trying to fix an outdated model that worked 50 years ago. The urgent and after our service has been made possible through a state-funded grant, and we're very grateful, and our community is very grateful. Thank you. The success so far we're going to share with you today, and this is for people in the Huon Valley, not just Cygnet. The Cygnet family practice urgent and after our service, the objective is to provide healthcare when and where it is needed, providing an on-the-day service in our practice or in the person's home, using nurse practitioners and paramedics. We have created an additional 72 appointments each week for the people of the Huon Valley to use. Imagine if this was a statewide happening. How much much would this impact on treating diseases early, preventing complications, which then impact on inappropriate calls for ambulance, attendance at hospital emergency departments and hospital admissions. Nurse practitioners and paramedics provide safe, cost-effective healthcare. They are regulated through the Australian Health Practitioner Regulatory Body, and they work in partnership with their national boards. They work in partnership with their national boards to ensure that Australia's registered health professionals are suitably trained, qualified and safe to practice. The people we are aiming to help are those with urgent needs, not emergencies. So what's the difference? It sounds the same to most people. So urgent care is when someone falls over and injures themselves and needs assessment for care of their injuries, such as painful joints or maybe a laceration or wound that needs suturing or stitches. It's not an emergency, they're not going to die. Okay? Another example might be when someone's fallen at home and they need assessment and perhaps help off the floor if they're elderly or disabled. Someone who has signs and symptoms of a kidney infection and needs urine sent to pathology and antibiotics ordered on the day to stop the infection from getting worse is another example. There are so many examples. When I first started as a nurse practitioner, I kept a record of reasons why people sought my help. I stopped counting at 63 reasons. There are many reasons why a nurse practitioner or a paramedic is the right health professional. Our team are supported by robust and clear escalation pathways when people present to us in an emergency. Because this is for urgent care, so we're not meant to be treating emergencies. But in general practice every day, we have people walk in and having heart attacks, and that's why I do that every day. So for the staff that we have on site, it's not something that we're not prepared for. Even though we advertise our services and give examples of our urgent needs, we will always have people come in within emergency with chest pain. When this happens, our team triage the person and provide initial care. They then consult a national telehealth service staffed by fellows of the Australasian College of Emergency Medicine. These doctors are experts in emergency care, so we've got our bases covered. In collaboration with Ambulance Tasmania, non-urgent ambulance calls are being referred to our service with thanks. This collaboration means that long waiting times for non-emergency requests are decreased. Non-emergency patients are being treated in their local community, and how exciting is that? Yep. In their own home. It's fantastic. And I've just lost my place here, that's okay. This partnership impacts on ramping of patients in the hospital. It has a flow-on effect like a domino, and the time paramedics are unavailable to the community because of ramping. Less non-emergency patients in the hospital emergency waiting rooms because they are already getting the care they need locally. This model of care supports the excellent care that general practitioners provide. All the research shows that with more elders and people with long-term conditions, the number of visits these people seek with their GP increases. Another reason why we need a new model of healthcare. Tasmanians and Australian GPs and people seeking healthcare deserve better. And with the support of everyone here today, we can act and make access to healthcare on the day when it's needed a reality. Enough time has been wasted. We have a practical working model that with further funding support and changes to outdated legislation, this service could be implemented to a 7-day-a-week service without the current barriers to practice and replicated around the state and Australia. I'm a vision person. Imagine what that would look like. I'm excited. You might have guessed that. So, in closing, thank you, Lord, for the opportunity to give the glory to you for the success of Cygnet Family Practice. Thank you.
I'm a paramedic working for Ambulance Tasmania. I work in the Northwest, and I'm a fellow of the Australasian Institute of Paramedic Practitioners, which allows me to call myself a paramedic practitioner as well. So, thanks. We'd like to start with just some background. Can we have a slide, please, Michelle? So just to talk about the beginnings, reiterating that we received a 3-year grant for $250,000 per year for 3 years. This grant has almost exclusively been invested into clinical service delivery. So hardly any of that is administrative. We got, as Kerrie alluded to, we have 72 extra appointments a week due to this service, and that's just over 3 days. So we employ nurse practitioners, myself, paramedic practitioner, nurse practitioner student, which is Carly, a receptionist, and we also bought a vehicle equipped with paramedic equipment and Ambulance Tasmania kindly sold to us. Slide please, Michelle. So some of the issues that we see in the after hours and service provision are primary care issues and subacute issues, and as the Premier alluded to, 40% of the people that rock up to ED fit this category, and I would suggest around 50% of those that utilise Ambulance Tasmania in my area anyway also fit into this. So things like simple fractures, wound care, flu-like illness. In the after hours and urgent care we do plastering and plaster care, and we also offer an outreach service, and we have lifting equipment the same as the ambulance have, so we can pick up people who have fallen at home, and we also provide in-house palliative care support for people in transitional care. Slide please, Michelle. So a service like this needs key alliances, and we've been working really hard to establish these over the last 6 months. One of our key players, of course, is our Memorandum of Understanding with Ambulance Tasmania, who has been fantastic, including us in their secondary triage referral programs. We work closely with PHT, thanks Claire for all the support coming there, and the others as well. We've also, of note, is the HMS Collective bunch from Victoria, who are paramedics working in community over there, so they're working outside the ambulance service as well, looking at how we can utilise the paramedic skill sets. We're also affiliated with the ASCNP, thanks Hayes, and the Australasian Institute of Paramedic Practitioners. Slide please. So the three key outcomes of the after hours and urgent care service are to provide additional opportunities for primary care health access visits to the Huon Valley. We also want to relieve the travel burden of those people that live in the Huon Valley so that they don't have to travel into Hobart, into the emergency department when they can receive their care here. And additionally, we want to provide alternative pathways for our established networks, such as Ambulance Tasmania and palliative care. Slide, please. So I just want to talk about a couple of case studies that might highlight how this service works. The first patient was a 47-year-old female. She was actually our first patient in the after-hours care that we outreached into Cygnet. She was 7 days post-operative after having a hip replacement. She called us in quite a bit of distress actually. She had a lot of pain, which we normally expect to get better after 7 days, not worse. So we went, Carly and I got in the car and went out to see her, and she lived up 2 flights of stairs, so she couldn't actually make her way into us anyway. She was going to be an ambulance call out, but we were able to get there first. She had a superficial wound infection over her site. We were able to coordinate with her orthopaedic team in the Hobart Private. I was able to prescribe her pain relief and antibiotics and stave off what probably would have been another 14 days of bed days just by treating them at home in her house on a Friday night. The second patient, Louise, is an 81-year-old palliative care patient who was awaiting palliative care. So she was in a transitional period. Her terminal phase was coming quite quickly, and palliative care hadn't been able to get out to see her, so we were able to see her and set up all the things that she needed. I think we did 12 visits before palliative care got to her and were able to support her at home. She was desperate not to go to hospital. We've also seen Jack, who was a 13-year-old male with a fractured ankle. He came to the clinic, was seen in the car because he was a little bit uncomfortable, given pain relief, sent to Kingston for an x-ray. It'd be nice to get an x-ray in Sydney, I know. And come back to us, and we were able to slab him up, send him on his way with some crutches to completely avert a hospital visit. And Trevor was a short of breath patient who couldn't get to the hospital, to the GP during business hours because he worked all the time. Because we were open on Saturdays, he was able to come into us. Unfortunately, his outcome wasn't good, but we were able to get him onto the path of good health care. Slide, please, Michelle. So just some testimonials about what our patients say. And really, at the end of the day, the patients don't really care who they see, as long as the care is considered, articulate, and provided timely with good advice. The patients really don't care. They've been very grateful to see us in the after-hours space. And this is some of the things that they've said about us. So I guess you can read for yourself. And I think that's me. Slide, please, Michelle. I'll hand over to Mike now. He's going to talk you through some of the data.
80% of patients that could be seen outside of ED, all of them could be seen successfully by a nurse practitioner, treated appropriately. Some of the data that we've collected shows surprising things and some not surprising things. The majority of presentations are for respiratory infections. Welcome to Tasmania. We all get a couple of them every year. Musculoskeletal injuries, simple wounds, simple stuff that you can easily do in any clinic when you've got the time. The infections like urinary tract infection. One of the interesting ones on this slide was one of our third highest was immunisations, which we think is quite simple, but people can't access immunisations during business hours. And they love to be able to come in on a Saturday morning or a Thursday night and get an immunisation. And we've been quite pro with that. Michelle? So some of the demographics of our patients that we've seen everyone from a 1-month-old to a 99-year-old, everything in between. Similar data to the rest of the country. Adolescents are a little bit underrepresented, but they don't like seeking healthcare, that's normal. And about 7% of our presentations identify themselves as Aboriginal or Torres Strait Islander, which is very similar to the Huon Valley data. This you can read for yourself, time of presentation. People like to be able to come in when the injuries happen. So we're obviously busier on Saturday when people are doing more things out and about. At this point, the data does drop off from about 7 o'clock at night and the service is open till 9:30. We'll keep an eye on that. Is that because it's winter and it's cold and no one goes out after that? Something, we'll just keep looking at that and then see how we need to go. Some of the simple things, everyone just associates nurse practitioners with, oh, you can write scripts or you can order an x-ray or something. But I can assure you, between the nurse practitioners that work here, there's nearly 50 years of nurse practitioner experience and well over 100 years of registered nurse experience. So there's a lot more to it than that. Having worked in hospital, a monkey can order an x-ray. Can you interpret it? Do you know what's going on? And that's where our difference comes in as well. But people like that data, so it's there. You can see how many x-rays, how many scripts we do for different things. The referral pathway, some of them are same day. As we said, people still rock in who have never seen a health practitioner in their life and they're scared and they turn up to us with their chest pain. And then we do have to refer them on to Royal Hobart Hospital, some via ambulance, as you'll see. But a lot of them we can sort out and then refer to an appropriate clinic, which keeps people out of the emergency department. The example that Ali used with the 13-year-old boy, he does have a fractured leg. We diagnosed it, we treated it, and we referred him to the orthopaedic clinic. He can be seen in a few days' time. Does not need to go through an emergency department for that. And I'll hand over to Andrew, who'll give you a few other things.
Thanks, Mark. So essentially, last slide, we're nearly there. So obviously, with any sort of new and innovative sort of models of care, and we're trying to change up how we traditionally have delivered health services in Tasmania, there's obviously going to be some obstruction or some barriers and stuff to be able to get us to practice to our full scope and to the full potential of our training and education. So obviously, there's three sort of key priorities and how we're going to try and optimise this service delivery. It's very successful. Obviously, you've heard it's all successful. There's models all around the world that demonstrate that these services are highly successful. But just to highlight a couple, so Champion Tasmania legislation changes to allow nurse practitioners and paramedic practitioners to work in private practice. So one of the big challenges, obviously, with private practice is number 3, and there's the changes with the MBS, and we're still developing the willingness to uptake nurse practitioners and those alternative models in the private practice space, because it's just not as profitable for business owners as traditional models as well. So hopefully, with the champions that are in this room, we can sort of lobby and help to bring that service back on par. Considering nurse practitioners and paramedics in strategic workforce development, I think certainly as with the years' experience, as we've said, that a lot of us have, and the dedication and the specialisation that we have, we're very passionate people, and we spend a lot of time and effort and given up a lot to be where we are in the position that we are, and so we're extremely passionate to improve health service delivery. And the biggest thing here is about servicing the community. I think one of the real advantages of being a nurse, and something that I'm very proud about, is our empathy and our connection with our patients. We're able to invest that time. We're able to look at them holistically and not just isolated diseases, that big picture, and how do we get the best health outcomes from you here and where we are now. So that timely access to high quality healthcare is really, really important, but I think that personalised element is one of the really adventitious and one of the added benefits we have as part of the nurse practitioner and paramedic practitioner models. I think that's about it, so I'll hand back over to Justice.
I think we'll do it together, won't we?
Yes.
Partnership. There we go. Hands on.
Me too.
Lovely. Another. This is an old house that was a family home.
Or ambulance has, and I was working down. So everyone's got a bit of a.
So you're a nurse
Yeah.
and a paramedic.
Yeah. Yeah.
Cool. But you can't do both at the same time.
Tasmania, we've got two heads. Yeah, exactly. So this is our reception. And this is our waiting room in here. And a bit of a kid's corner. Generally, we don't give away pretty on the money. Yeah.
It's a drink when you visit the doctor.
It is a dream. So there's bathrooms here and we've got a met call trolley, and Phil's going to organise a Zoll for us, which is great. One of the
You don't know this yet?
Yeah, that would be amazing.
Good job.
So we've got like all the drugs and airway and everything in here that we need. So that's all pretty good. Bathrooms in here.
So that's all checked daily
We do
and stuff.
procedures in here. And we've got an autoclave in here,
Yeah.
which is like one of my favourite things to do. Because I like being all dust and tidy and clean. But anyway, so autoclaves in here. So typically we'll run through like maybe 15, 20 instruments a night. This is, we have our HCG in here. This is the only 12-lead ECG we've got, but it's linked to our laptop. And we can just link that to our best practice and then either send it to the Royal or, I don't know, whether we can't send it to 18 yet, but we can interpret the rhythm and say this is what we've got.
And we have the MyED doctors as well that we can engage with and show them on the video conference.
Yeah.
Telehealth.
Yeah. And we've just done a sleep thing. We can do the sleep study thing. We've just signed up for that. It's all very complicated because I haven't done one yet, but I'm sure we'll be okay at it. And people go home and if they are like a candidate for CPAP or like the home oxygen kits and things like that. Yeah. So that is that room where the ECG is, and we've also got the other monitoring, like when the paramedics come. So paramedics come out this way here, and we've got a ramp out here for them to bring this. This is where the ambulance ramps come.
And I hope you've taken the measuring tape and made sure that
The first thing I thought was turning circle.
It's a good turn.
First thing.
It's an easy 12-point turn.
And we've done a laminated flow chart of what you do when you call an ambulance and how you prepare the patient and the paperwork that goes with it. So that's good. That's good for AK, they love it.
We're gonna photo of that one.
Friends.
Where's the picture?
Midday, but we do pathology as well. Like all of the nurses do it as well. If
Nurse
there's-
practitioners do it as well.
and the nurse practitioner. Oh, everyone can do it.
Yeah.
But we have dedicated homeopath at these hours, at 25 to 11:45. Yeah. Kind of. There's a few crossovers. Registrations every day that I'm here of new people, like all between 20 and 30.
And
So the
how long have you
demographics
been here
changing.
for?
I have been here.
Well, the practice has been running for
I think we moved here 3 years ago. Check with Kerrie, but we were in Frederick Street before that.
Yeah.
Yeah, which is now the just a nurse-run health clinic. Yeah, so they'll do things like wounds and things like that. They don't go out though. I've actually never met them, but yeah. So does anyone have any questions?
That,
But that's what